Welcome to my channel Medicine Guide. What is Alprazolam Xanax? Alprazolam is a benzodiazepine. It is thought that it works by enhancing the activity of certain neurotransmitters in the brain. Alprazolam is used to treat anxiety disorders, panic disorders, and anxiety caused by depression. You should not take alprazolam if you also take itraconazole or ketoconazole, have a history of allergic reaction to any benzodiazepine, alprazolam, lorazepam, diazepam, Ativan, Valium, Klonopin, and others. To make sure alprazolam is safe for you, tell your doctor if you have ever had breathing problems, drug or alcohol addiction, depression, mood problems, or suicidal thoughts or behavior, or kidney or liver disease. Tell your doctor if you are pregnant or plan to become pregnant. Never share this medicine with another person, especially someone with a history of drug abuse or addiction. Misuse can cause addiction, overdose, or death. Get emergency medical help if you have signs of an allergic reaction to alprazolam, hives, difficult breathing, swelling of your face, lips, tongue, or throat. In this video we will discuss uses of alprazolam Xanax and its side effects. So let's start our discussion. But before that, please subscribe to my channel Medicine Guide. Now we start our discussion. Alprazolam is a prescription medication that belongs to the class of drugs known as benzodiazepines. It is primarily prescribed to treat anxiety disorders, panic disorders, and sometimes as a short-term treatment for insomnia. Here's a detailed overview of its uses. 1. Anxiety disorders. Alprazolam is commonly prescribed for various anxiety disorders, including generalized anxiety disorder, GAD, social anxiety disorder, and specific phobias. It helps to alleviate the symptoms of anxiety, such as excessive worry, restlessness, and tension. 2. Panic disorders. Alprazolam is also used in the treatment of panic disorder, which is characterized by recurrent, unexpected panic attacks. It can provide rapid relief from the intense anxiety and panic symptoms associated with these attacks. 3. Insomnia. Alprazolam may be prescribed for individuals who have difficulty falling asleep or staying asleep due to anxiety-related insomnia. However, it is generally used as a short-term solution because of the risk of dependence and tolerance that can develop with long-term use.
4. Muscle spasms. In some cases, alprazolam may be prescribed to alleviate muscle spasms and tension, although this is less common than its use for anxiety and panic disorders. It's important to note that alprazolam is typically recommended for short-term use due to the potential for dependence and withdrawal symptoms if used for an extended period. Long-term use should be carefully monitored by a healthcare professional. The dosage and duration of alprazolam treatment are individualized based on the specific condition being treated, the patient's response to the medication, and other factors. It's crucial to take alprazolam exactly as prescribed by a healthcare provider and to follow their guidance regarding when and how to discontinue its use. Furthermore, alprazolam can have side effects and interactions with other medications, so it's essential to discuss its use thoroughly with a healthcare provider to ensure it is the right treatment option and to minimize potential risks. Never self-medicate with alprazolam or any other prescription medication without proper medical guidance. Alprazolam, like other medications, can have side effects. It's essential to be aware of these potential side effects when taking this medication. Keep in mind that not everyone will experience these side effects, and some people may experience them to a greater or lesser degree. Common side effects of alprazolam may include 1. Drowsiness. Alprazolam can cause drowsiness and sedation, which may impair your ability to concentrate or operate machinery. 2. Dizziness. Some individuals may experience dizziness or lightheadedness while taking alprazolam. 3. Fatigue. A feeling of tiredness or fatigue is a common side effect. 4. Dry mouth. Alprazolam may lead to a dry mouth. 5. Changes in libido. Some people may experience changes in sexual desire or performance. 6. Slurred speech. In some cases, alprazolam can cause slurred speech or difficulty speaking clearly. 7. Memory problems. Short-term memory impairment can occur with alprazolam use. 8. Muscle weakness. Weakness in muscles, especially in the legs, may be a side effect. 9. Headache. Headaches can sometimes occur while taking this medication. 10. Nausea and vomiting. Some individuals may experience nausea and vomiting. 11. Constipation. Alprazolam can lead to constipation in some cases. 12. Weight changes. Changes in weight, either weight gain or weight loss, have been reported. It's important to note that these are not all the possible side effects of alprazolam. Some individuals may experience more severe or less common side effects. Additionally, alprazolam can have interactions with other medications, so it's crucial to inform your healthcare provider about all the medications you are taking. In some cases, alprazolam can also lead to more serious side effects, such as allergic reactions, rash, itching, swelling, severe dizziness, difficulty breathing, mood changes, agitation, aggression, hallucinations, uncontrolled movements or tremors, changes in urine color, signs of infection, for example, fever, persistent sore throat. If you experience any of these serious side effects, you should seek immediate medical attention. Remember that alprazolam should be used only as prescribed by a healthcare professional, and the benefits and risks should be discussed thoroughly with your doctor. It is typically prescribed for short-term use, and long-term use should be closely monitored due to the risk of dependence and withdrawal symptoms. If you have concerns about the side effects or effectiveness of alprazolam, talk to your healthcare provider. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.